Hi, everyone, and thank you so much for listening to the Facilities and Focus podcast. My name is Mackenna Moralez, and I am the Associate Editor of FacilitiesNet and your host. Today, I am joined by Brian Forde Jr. Brian is currently the Chief Operating Officer for Boston Public Schools and previously served as the Executive Director of Facilities for Boston Public Schools. In his role, he manages over 1,000 staff members and leads a team that encompasses a variety of expertise from engineers to maintenance professionals. He is passionate about working together to create a supportive environment for students and staff alike and ensures that operational strategies align with educational goals. Thank you so much for joining me today, Brian. How are you?
Hi, McKenna. It's great to join you. Definitely doing really well. It's cold here in Boston, but definitely not as cold as it is there. So it's good to be here.
Yes, I know. For our listeners, we commiserated about the winter already. So I'm sure it'll continue on by the time this podcast goes live because Wisconsin weather is tricky in that sense. But I have you here today to talk about the COVID-19 pandemic because I guess you can say that 2025 kind of kicks off the fifth. And I don't know if we can necessarily call it an anniversary because that seems pretty bleak, but it's been 5 years since the coronavirus pandemic first started. So, can you just tell me that or explain that initial feeling that you had during the early days of the pandemic and what was the experience like of having to shut down Boston schools because it's a major city. I can't imagine how stressful that was.
Oh, yeah. So it's going to be really interesting to explain the early days because at the beginning, we didn't really have an idea of what was really happening. So I would say it was like late December, we were getting notifications of, hey, there's something happening overseas. People are starting to get sick. January was it's starting to get a little bit more real. And just for clarification, I wasn't the chief of operating officer at Boston Public Schools. I was actually the assistant building systems director um, manager at City Hall, so Boston City Hall. So it was now having to worry about a kind of slightly different set of buildings while knowing that we would have interference with the BPS buildings as well. And in the early days, we were getting like lots of phone calls that were happening late at night on the weekends. Are we going to shut down the city? Are we going to keep these buildings open? Who is essential in these types of cases? And so I remember being out to dinner, getting a call from some members in the mayor's office, and they went, "Hey, we're thinking about shutting everything down tomorrow."
Oh
And I
my
was like, "All
goodness.
right, that that's that makes sense. How do you want to do this?" And from like that point on, and that was kind of in March, how do you want to start that operation of who's emergency, who's in person, and then me also telling the group of people that I was with, I hope you would enjoy this last meal because they're gonna shut down everything.
Right. Oh, it's just it's scary kind of looking back at how just overall how scary that time was. And I'm sure our listeners are like, this girl is afraid of everything, but like we didn't know what was happening at all. It's just like 1 second you were able to go outside, and the next people are like, if you go outside, you might get sick and die, basically.
Right, right. And I would say like the for us, we were another big city, and what we were seeing was like the cruise ships were down. New York was getting hit really, really hard. Um,
Hmm.
so we were kind of like almost scared stiff to the point where like we had minimal interactions. We're trying to increase our airflow rates as much as possible. We're telling people that they don't even need to work in the same office if they typically work in the same office.
Right.
Kind of like one person per office is what we want right now. Um, and then we start coming up with all these additional things like masks are there, but you need to get them yourselves. They're not being like provided. So
Mhm.
everybody's got like these cloth masks, and then they're saying that those masks don't work and handkerchiefs don't work. So it's just kind of like this constant evolution and response of how do we keep things operating while we continue not to have people there to operate. Uh,
Mhm. Right. I remember I previously wrote for the supply chain at a different job while the pandemic first happened. And I was actually at a supply chain trade show when it was all going down. And like all these supply chain vendors were breaking down their booths early and sending their people home. And me and my coworkers are just like looking at our phones, watching the entire world just shut down and saying, like, seeing on social media, people are saying there's no toilet paper in the stores. Our kids are getting sent home early. Spring break is supposed to last 2 weeks. What are we going to do? And as we now know, it wasn't just 2 weeks. Was that the initial plan that Boston had as well?
yeah, so we thought that essentially if everybody could stay home for 10 consecutive days,
Mhm.
then we would be able to scrub it out, right? We wouldn't have to worry about it anymore. Because if everybody was home and everybody was isolated and everybody was by themselves, then technically everything would have run its course, even if you were just exposed.
Right.
But that didn't happen, right? People were meeting up in secret. They were, I was outside, I had to get permission to walk my dog. People will be, are you an essential employee? Like, well, what do you want me to do? Is my dog supposed to go in the house? No,
Right.
I still need to go out there. I still need to be out in that weather. So I would say, yes, we thought it was going to be a 10-day thing, that school was going to be also, out for a limited amount of time. And it also became like, how do we also set up this infrastructure to support the families that don't have access to all of the resources? Like, so you just said, I just went to the store and toilet paper was the hottest commodity on the market. But there were some families that didn't have food, and even like the grocery stores and shelves were bare.
Right.
And our teams at BPS and across the city, we actually do food donation sites and shelters. And so we really switched gears for our means of operation, meant 1 to 2 people in the building handing out essentials to those in need.
That's really nice because I know that I was living in a very small town at the time, and a lot of people were struggling. So the school district actually started to provide free lunch for everyone, and they would do lunch drop off for the kids. And I think that a lot of people forgot that sometimes those are the only time that some kids get to eat is at school.
That's right. Yeah, so up to 3 times a day, we were providing meals not only for the students and the children, but also the families. Right, so everybody would be able to get a meal that was there.
Oh, and that's really nice that you thought about people so much.
Yep. And it became a thing that of practice. So when I did join the school district, we were still in, I'll say, I always refer to it as COVID ops.
Yeah.
uh, so we were still in COVID operations, and we're trying to figure out like, our students coming back, our teachers coming back. I have teachers writing to me like, how can I guarantee like this room is safe? One of the things that we did in BPS that I thought was kind of a really big influential thing was we were one of the first districts to implement indoor air quality sensors in
Okay.
each one of our buildings, and it measures 2 different types of particulate matter. It also does temperature, relative humidity, CO, and CO2.
Mm.
And so, with all those metrics by each classroom, by the way, in every single classroom across the district, and a
Oh, wow.
live dashboard of interaction, you can see what the air quality is like in your individual space.
That that's so much data to have. Um, do the kids know what that is now, at
So
least?
I would say a lot more teachers know. We still do have an online learning portal for what it is and what it's about and how we're improving the air quality in the district. And we provided like air purifiers for every room and fans and refresh rates and made sure our air changes per hour were high enough by our different, metrics in our city. And so that really helped add a level of comfort while also telling people if you're sick, even a little bit sick, you got a cough or a sneeze, don't come here. uh,
Right.
yeah, don't come in. And so people started using like more sick days, which I think was kind of stigmatized before, where it's like you can't really get sick. It's not
Mhm.
appropriate to be sick and stay home if you're sick. And then it became, all right, well, if you're sick, stay home, don't come in. Maybe don't come in for 5 to 10 days. Maybe don't come in for 2 weeks. Maybe don't come in for 21 days. And that metric kept changing over and over
Mhm.
and
How stressful was it to just kind of be flying by the seat of your pants for like 2 years because of the standards keep changing?
so I actually really enjoyed it. So I like the chaos of not of the unknown. So I
Okay.
like having to continue to prepare, continue to get things in place. And I think one of the best things for us was there seemed to be an unlimited pot of money as long as it went towards the air quality or it went towards COVID or almost like a relief operation. And for the first time in a long time, people were investing in the one thing or a few things that they can't see. You can't see
Right.
germs, right? You can't see air quality. You can't see what it's like when somebody sneezes and it travels through another space.
Mhm.
And they, you know, Boston is one of the oldest school districts and has the oldest buildings in um, the United States. As
Mhm.
one of the first settlements in the United States, but um, people weren't investing in these things before. And so it became a time where I can now put air purifiers in place. I can put better HVAC systems in place. I can increase the filter sizes and rates that are there for general human occupancy. And I can now start making a difference. I had unoccupied buildings, which meant that I'm getting more construction done during this time period because I don't need that many people working together or in close proximity to get construction work done. So I was able
Yeah.
to really expand on that. And then we started implementing like high touch areas for our cleaning, more hand sanitizer and cleaning stations and green cleaners for anybody that happens to be visiting the building, as well as like here's a mask if you might need it, and here's a COVID test kit if you might need it, that we provided for them as well.
Right. Like this wasn't a blessing, and it's hard to say that it was an opportunity to, or even it's not a good thing that this pandemic happened, but it was good that you were able to improve your facilities so much because of it.
Yeah, yeah. And I would say it at least got us to a starting point where we're still there able to piggyback off of the decisions. I must have written a million proposals for how we're spending the money over this time period, but I feel like it really helped us to continue to keep this at the forefront of the investments that the district, the state, the city, and the nation are investing in.
Right. Especially since parents really started to care at that time too, because the last thing that you need is just like an army of angry parents knocking down your doors.
Oh, so there were, there were,
Oh, sorry for trigger warning, angry parents.
it seemed as if there was, there, don't get me wrong, a whole lot of anger, a lot more confusion, and a lot more, well, it's not what I think it should be, right?
Mhm.
And I think that's where we had like a little bit of the most turbulence of there's what we are required to do, what we know that we should do, what we can do, and then here's what parent A wants us to do, which may
Right.
not be the best solution or the most transferable solution across 125 school locations for us,
Right.
especially when it comes to budgeting it. And we did see that there was definitely more than 4 parent group organizations to form out of this that even to this day continue to um, show up in my inbox, is what I'll say. They continue to show up in my inbox and
Right.
ask me questions.
Nice that everybody has a passion, I guess.
That's right.
And like you both want the same thing, though, is to protect the kids.
Yeah. So I guess my method of attack is different because it's something that generally being in operations for over a decade at this point in my life, I've been exposed to more things. Like I know that, there's so many different environmental factors as it relates to construction for our workers. Like when we're dealing with, um, like lead-based materials, when we're dealing with asbestos-related materials, when we're dealing with airborne contaminants and things of that nature. These are things that we were ready to deal with, and how we create contained environments in order to deal with these respective situations, especially when it comes to things like PCBs and other materials that are friable and can create long-term health issues. And so when I start relating the two of them, and not mentioning them, because mentioning them definitely is not going to be more settling for them. I start mentioning
Right.
some strategies we use in order to mitigate these things. Um, they, they being the parents, oftentimes don't see eye to eye on how I can create a global response and keep things contained. And kind of the easiest way to make sure nobody is going to be contaminated from one another at the time: keep your distance, stay home if you're sick, wear your mask, test often. Um, and we'll make sure the air change rates are as high as they possibly can be to make sure
Right.
nobody's getting sick. And then they're like, do I keep my window open in the wintertime because but today
Oh,
it's 20 degrees. For you it's the teens. So do I keep the
right.
window open, or do I not, or do I keep the heat on, or do I not, or the air purifier or the fan? And so it just became like a ongoing response.
Right. And the citizens of Boston aren't like widely known for being kind people too.
Yeah, they have a lot of choice words for Bostonians. Um, yep. And yeah, I've heard a lot of these words as well. And I've had a lot of these words directed at me, towards me, for me, against me, and that's okay. I think you receive all the complaints, and then you think about what the right response is, and how you can take this person's concerns that may have come out in a very irrational manner, rationalize what the right way and right concerns are. And sometimes that means I'm going to sit 24 hours before I respond to this email or this phone call, or I'm just going to, yep, and nod my head until I
Yeah.
can take time to calm, cool, and collective respond with the concerns that they are most worried about.
Right. Um, what was your strategy for communicating timely updates to students, parents, staff, and other stakeholders?
Oh, yeah. I'm pretty sure our whole communications team quit
Oh
during
my
this
goodness.
But
Sorry.
essentially, with everything that we were doing, we were putting it out in almost a weekly manner. So we would, hey, across all schools right now, we are working on getting 2 air purifiers per room, 2 fans per room. We've procured this. And I would say it was nearly weekly that we were putting out a communication for the general public to
Mm,
understand. And we found different ways of doing that. We created templates during this time because the transparency in our communication um, definitely increased more than tenfold during this time period because people want to know, right?
right.
Whereas before, um, especially for the facilities team, we speak to the custodian in the building, maybe the teacher, the principal, and that's like it. There's not a
Right.
whole lot more communication than that happens on a daily basis. And now I have to have somebody that maybe hasn't put together a formal memo in 5 years. I have to start working on putting all the technical jargon into a nice cohesive communication for the right targeted audience.
Right.
So,
Ooh, that I could felt really stressed out for you just thinking about it. Oh, what was the time frame of getting students back in the classroom full time?
can you elaborate on that? Like, what is the time frame that we were out of school, or what is like how
Yeah.
long did it take me to get kids into the buildings again?
I guess how long did it take you to get kids into the building? Were you get was Boston staggered at all?
So we we came back with a hybrid model at first, and
Hmm.
it didn't work well. And so, if students were essentially left school in March of 2020, and then for us in 2021, it was kind of like a rolling hybrid-ish type program for us to get back into the schools. And so, in fall of 22 is kind of the first year that we were back to normal operations. So
Wow.
that was, I would say, a year and a few months after I started that we got back to normal for the school district.
Wow. That seems like a long time.
Yep. And
I
so
Go ahead.
I was just gonna say, so for I think there's so many generations of kids that missed out on the prom. They,
Yeah.
they missed out on kind of like those the senior prank, the end of
Yeah.
days type of thing, and the beginning of days for like their college experience, right? So
Hmm.
going to the dorms was just like not a thing for the city as well, and that usually had a big impact on Boston public schools because the move-in date is around the same time that we are starting school.
Oh, of
And
course.
so I've never, if you haven't heard the phrase stirrode, look it up. You're
Oh
gonna
yeah.
love it.
Okay.
We are used to things like that happening on the first day that make it very difficult for us to operate like our transportation because you got a million moving trucks on the road for people that have never driven a truck before. All of a sudden, crowding our streets, crowding our school areas, and either way, the different story didn't happen that year. I thought that was great, but obviously not great for all the good reasons.
My husband is a teacher, and he was a teacher for a very, very small district. Like, I think the town is just 1,000 or 2,000 people total. So very different than Boston. And if I remember right, they were in school full time by 2021, like the beginning of 2021. And even that sounds crazy, just like saying it out loud. But what you were saying about children missing milestones, my niece was in kindergarten when the pandemic first started. And that seems like a very pivotal time to
Yeah.
be taken out of school. And just feel so bad for the kids because like you said, they miss out on all these milestones, but also just like very formative years.
Yeah, yeah. And because we are we have a lot of parents that also work for the school district. It just works out that way.
Mhm, of course.
And so the longer that we didn't have a solution in place for keeping kids in school, how are we then going to tell people that they actually had to show up for work as well when their kid doesn't
Right.
have a daycare, they don't have a school, they don't have transportation, they don't have any of these other things that are in place? And so they're like, well, my son or daughter or my child is 4. What do you want me to
Mhm.
do? You want me to come to work? You want me to bring them to work?
Right.
What's my median here? So that was something that also made it really hard for us to be fully operational right
Mhm.
away. And I would say we were fully operational by 2021, 2022 school year, but at the same time, it wasn't a normal school year, whereas
Right.
2022 was a normal school year.
Right.
22-23 was a normal school year.
Were there any initiatives or strategies that surprised you in their effectiveness?
Um, so I think that one of the things that we did was we became like a mass delivery system for COVID test.
Okay.
So I would say that that was pretty surprising. So while we do have like our warehouse in the district, we were now every time there was a school break, we were making sure that every student had at least 2 full test kits, so at least 4 tests to go home with and make sure that they were testing and quarantining as necessary before returning to school or especially after a holiday. And that continued to change. I would say the thing that was most surprising to me, this is definitely probably still one of the most controversial topics, is the vaccinations.
Okay.
Um, And it was because a lot of people were afraid to get vaccinated.
Right.
And our city came out with if you're not vaccinated, then you can't work here any longer.
Okay. Oh,
Um,
sure that
so
didn't go
people
over well.
were, no, people were, I will quit before I put this random thing in my body. Some people were like, I'll get vaccinated in right now if you tell me where I can go. And
Right.
so I think that created a lot of confusion for people.
Mhm.
And it was guidance that came down as our city, right, of things that we had to do. The
Mhm.
turnout of that, because of the time frame of how we were progressing in COVID in general, made it so there was very minor negative effects. But it did put us in a place where like I had so many people that were so uncomfortable. I'll wear a mask longer than I need to. I'll do my exposures longer than I need to. I'll use all my time off, and it just became like that. I would say that initiative became very hard to manage. Uh,
Mhm.
the clean air and continued like airflow and quality, I think that became something that we were more transparent with, created more responses to, did trainings with our custodians on, and made sure that everybody in the building knew how to respond to an elevated something. Whether that was the CO2 or the particulate matter, or, we probably shouldn't be eating, in that space because that's not a cafeteria, right? It doesn't have the ventilation
Right.
rate you need. Oh, that room is higher. It's because you're using butane, right, or aerosols
Mhm.
in the space, and so getting a little bit more stringent on that definitely helped us out a lot as well.
Right. What other types of training did the facilities team or even more of the other staff members do to help ready themselves for a future pandemic?
Yeah, so I think dealing with a future pandemic, it all depends on what we would be dealing with, right? Is it airborne again, or is it passable on surfaces? I think figuring those pieces out would definitely be instrumental into us understanding how we would respond to the next pandemic, right? And so we actually made really good partners with BPHC and always have been on our response, and that's the Boston Public Health Commission.
Okay.
And so they also work with the Mass Public Health Commission as well. And I would say that it became the high touch areas, the wear your mask, the sanitation stations, teaching them where to do that. We had different tools. We had like this ozone layer spray thing. You've probably seen it, and you walk
Yeah.
through, and it's supposed to make everything better in a specific space, increasing the filters, changing the filters, not only on our HVAC and mechanical ventilated spaces, but our ACs, our water filter. We actually stopped using water bubblers altogether, and now we did
Okay.
bottle filling stations. So, like, I do think that in terms of transmissions of human to human bacteria or contagions or illness, we've gotten much better. And I would say that not only have our custodial and day-to-day building staff learned so much more from it, but our responders, our supervisors in their respective trades have learned how to be safe in those areas as well. And even today, somebody walked by, they're helping families sign up for school. It's our school registry season right now, and people are wearing masks because they know they're servicing 3 and 4 people at a time, and they don't know,
Right.
but taking more responsibility for their personal health, staying home when they're sick, trying not to sneeze and cough on others or other things, which is just always nice.
Right.
And I think that those are lessons that'll stick with them for a very long time.
Right. Do you think there'll ever come a time where schools will shut down in that same type of way again?
I don't think so. I'm not going to say that I don't think it'll happen again. I don't think that it'll happen again inside of my career with BPS. And I say that
Okay.
because I got to talk to my grandmother-in-law, who is 90, and she saw this once before with the Spanish flu.
Okay.
And I was like, oh, they shut down everything. They gave out little vaccination cards. This sounds so familiar, but the infrastructure wasn't where it was today. The pictures weren't where it was today. Communication wasn't where it was today. There are
Mhm.
so many things that were lacking where it was like, don't see anybody for 10 days. They probably got through it a lot faster than we could have.
Right.
I probably need to do some fact checking on that as well to see exactly how fast we got through some of that. But so what I think is it might be on another cycle in 70 years, right? And
Mhm.
hopefully 70 years from now, if I'm still alive, I'm not working. So
It would be a miracle. You would be in so many books.
yeah, well, maybe.
Um, are you conducting regular drills or simulations to test pandemic preparedness plans?
I would say we every year add in those trainings to our custodial team. So we have a custodial trainer who's always doing up to date trainings on these things. We have more things that are in our building management system that we're looking for. I would say, in terms of drills, not as much, but in our yearly trainings, yes,
Mhm.
where we start talking about different things that are required. And then we also have like a few of them that are online, not just in person, but online, where they can learn about kind of the different things that are around as well.
Mhm.
And there's definitely room for improvement as we begin to understand more about this. Doesn't just help us with COVID, it helps us with the flu, it helps us with um, I'm gonna forget the names of 100 different other illnesses that make their way
Any
through
type of
public
sickness.
schools. Yeah, but it helps us with so many of these others, like the chicken pox. It's not a thing anymore, really, but things like that.
But that's the thing. We don't want them to become things
Right.
too. So wash your hands, stay home if
Yes.
you're sick. Um, what steps are you taking to build resilience in your facilities, staff, and community for long-term pandemic readiness?
So I think the one thing that we're doing is that we're continuing to make sure we have this relationship with the BPHC. And
Mhm.
while we had an environmental department before, we do environmental audits on all of our schools every single year for making sure that building is as healthy as can possibly be. That is then released to our facilities team, our safety team, and our custodial staff so that they can know exactly how to respond in different issues. And it won't be just, oh, this is a COVID response and contaminated. Again, it's things like the common cold and the flu and hand, mouth, foot disease, I think is one of them.
That's the
So
thing. That's the thing.
so it's a lot of that, and like it really took us a long way from okay, we got here and we came in with some Clorox wipes because somebody was sick. We wiped down the table that that person was at and we left. Now it's okay. Now we came in, we made sure overnight that we did all the high touch areas. We used the green cleaner. We might have used the ozone machine across these different places as well. We made sure that all the chair surfaces and things that are used in that space are done. We escalated the exhaust fans in that space to make sure that any contaminants are making their way out of the building. And that's how we respond now to even localized infections or outbreaks and make sure we keep more kids in school when something like this happens. It meant that there was heavier interaction with our nursing staff that is in the buildings as well. And our custodians know so much more about the day to day. And it does now, when we look at our long term planning, the air quality is something that is heavily considered
Right.
when we look at what that's like. And we don't want the minimums. We don't even want things that are just above the minimums. We want as high as it could possibly go, as far as it can possibly be, making sure that this building is meeting all the standards of, a 21st century and beyond building, and that can withstand the test of 100 years from now, because we don't know how dense things would be.
Right. I know this is kind of a silly question, but how has the term resiliency changed for you since the COVID pandemic?
Ooh, there's no silly questions. Resiliency. I like to, I would say It's a tough question to answer. Uh, I would say when we talked about things that were resilient before, we definitely didn't talk about them as much as we would equipment. So we never said that this equipment is resilient, right? We would say it
Mhm.
would be more for people. This person's really resilient to whatever's happening now. And now I would say when we're referring to that, like we are now referring to our objects in our buildings and how resilient they are to the changes that are going to happen, and making sure that they are standing and that they are the same. Because, like I was saying before, some of our buildings are 100 years old. I guess our average building is 100 years old.
Oh, no big deal.
So when we think about things like that that are resilient, it's going to be our buildings, but also the air quality that's in there as well. Instead of being referring directly to an individual who might be going through a certain circumstance, when we're saying that they are resilient now, it applies to kind of both situations.
Well, I know that during the pandemic, we all clapped for the healthcare professionals, and we clap. Well, I clapped for the teacher because I lived with him, but we got to clap for the facilities and the operations worker because, oh my God, did you guys put in a lot of work? And that's what I love about writing for facilities management is because you guys keep the building going. You keep people safe. You keep the buildings operational. So I'll clap for you. You did it for us. Woo! Woo! Go facilities. I really appreciate all the work that you guys did because I really love my husband. I really love my niece. And because of all the work that facilities does, you kept them safe. And that matters most to me.
I appreciate that so much. Thank you. We're just trying our best to make sure that we could adapt to anything that happens to us, anything that's happening to the buildings. And yeah, that's our number one priority, keeping our community safe and able to learn. And, you know, hopefully we can continue to do that for many, 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 many more years than I will be here.
Yes, and let's hope there's never something like it again.
I hope so. I hope
Yeah.
so.
Well, thank you so much, Brian. I really appreciate it.
Oh, thank you, McKenna. I was happy to be here. It was a good time talking with you.
All right. Thank you.
Thank you for listening to the Facilities in Focus podcast. Facilities in Focus is a product of the facility market, which houses FacilitiesNet, building operating management, facilities maintenance decisions, and healthcare facilities today. Thank you to our sound and video editor, Paul Ellertson. Thank you to Morgan Johnson for designing our logo. Thank you to Dan Welton, Dave Lubach, Dan Hounsell, Jeff Warden, Jill McDermott, and everyone else at Trade Press Media Group. For comments, or if you are interested in being a guest on Facilities in Focus, please email us at fnpodcast@tradepress.com.